behind the scenes.
And she will come back. Thanks for coming, and we just decided that this month was one of the times we ought to do a little discussion of the process we've probably all gone through, and some of us are still going through, figuring out how to treat, how to diagnose, how to do all these things with these crazy prostate cancer issues. I asked Jeffrey Hull to come in, and he's been with us for several months now, and he's kind of the classic example, I think, of what we probably have all gone through or are going through now, trying to figure out what the issues are, what the symptoms, what the solutions are, and how we go about getting those solutions. So between Jeff and myself talking a little bit about radiation and some of the other alternative radiation types of treatment, and Ed, who's had prostate removal, I think we can cover some things, and all of you obviously have gone through your own set of circumstances too, so maybe we can all learn something from this. And I thought I'd ask Jeff to just kind of quickly outline what he's going through. It probably can't be quick because it's quite a story, but if you can do that in a couple of minutes, that would be great.
Sure. Can I speak about that?
Yeah, I think.
If you can't hear me, let me know, okay?
I think we can probably pull in a little more too. Yeah, this is probably not critical.
Well, I joined the club back in May 9th, when last year my PSA was 6.1. They wanted to do more testing. I said, let me get on Medicare in another 6 months. So I went back a year later at PSA 6.2. Want to do more testing, want to do biopsy. Okay, the biopsy came back three cores positive on only one lobe, with at least 6, 7, and 8. And then I was advised by Steve, who's not here yet, who's with Me Too Group.
Right, Steve Gordon.
And some of the other people with Prostate Cancer Research Institute and so forth. I was advised to, so one of the most important things you can do is get a second opinion on your labs. So I had my labs sent off to Johns Hopkins. They pretty much confirmed that my labs were accurate. So being at least in 6, 7, and 8 put me right into the category, even though I had a low PSA and some of the other categories. I think there are four criteria to be high risk, but if you have any one of the 4, boom, you're automatically into high risk. And so at least an 8, boom, put me into the high risk category. Of course, the urologist said your options are, surgery or radiation. In my own mind, I had pretty much eliminated surgery right off the bat. I just didn't feel it was right for me. So all of my homework for the last several months has been, reading every book that's out there, doing all the research, joining groups, the online group Inspire, doing all that stuff. I got a package of information sent to me. I called up UF Health in Jacksonville, who does proton treatment. They immediately sent me a package that's pretty slick. They must have a whole marketing department, which is
They do.
And
who is this from?
UF Health in Jacksonville.
Oh, UF, yeah.
And their proton treatment center.
Right.
And in that, there's a list of several hundred men who've all been treated. They call themselves prostate ambassadors. Well, I called about 6 of those guys. I called 2 other men that I knew in Oklahoma that were both in their 80s, that were treated 10, 12 years ago.
How old are you now?
66. I'm the average age that we get surprised, right? And so right off the bat, there were 8 guys that said proton treatment was the greatest thing in the world. Don't even think twice is going to do it. And I had spoken with men that had it done a year ago and men that had it done 10 years ago. And I got a hold of one guy who was on the prostate ambassador list. I thought I was thorough. Nah, this guy told me he called every man on the list.
Oh my gosh.
Every one of them on the list. So obviously he was very, very pro proton therapy. When I've had multiple consults, my urologist recommended a radiation oncologist that I meet with that's with his same company. met with him. He wanted to do brachycedes and IMRT, conventional radiation, photon radiation as opposed to proton radiation. And when I asked him about proton as an alternate, he got a little upset. Obviously, they said, well, yeah, he got a little bombastic with it. Oh, it doesn't work. It's just that the business model's going to fail and da. But you have to understand, it takes $150 to $200 million to build a proton center. There's only about, depending on what website you look at, probably between 24 and 30 of them in the country. Some are still under construction. And so I was, from the beginning, I was really kind of leaning towards proton. And then when I did my research, I learned the difference between proton radiation and photon radiation. This proton radiation has a characteristic to it, and you got to get into the physics, which is way over my head, what they call a Bragg's peak. So conventional radiation comes into your body, hits the tumor, and then exits the body. So you got other parts of your body that are getting radiated. With proton, supposedly it comes into your body, releases its energy at the tumor, and there's like very little or no exit dosage. That's what the literature and the science says. So if anybody's got any experience with any of this, I'd love to hear it. So the bottom line though is I haven't made my final decision. Right now, I just got confirmation this morning, the end of the month, I have another imaging test done in Orlando.
Yeah.
And it's where they take the PET scan and the CT, and then you go back the next day and they do an MRI, and then they overlay all of them together. And because I have what's called suspected extracacular extension.
What does that mean?
That means that most likely the cancer is not confined just in the prostate. It's probably leaked out a little bit. And it leaked out, when it leaks out, you can get to your seminal vesicles, your lymph nodes. And so I want to get to, I was going to be already in Jacksonville until I heard about this extra test. I talked to the doctor in Jacksonville in the proton. He said, I don't think you need that test. It's pretty expensive and you got to pay for it out of pocket, $1,400. He said, there's probably only about a 20% chance that you have that. And I said, if you told me 2% or 5%, I'd agree, but 20%? I said, there was a 17% chance that I was going to get prostate cancer, and I won that lottery, okay? So I'm not willing to, I said, so I felt it was worth it to push it off a month to deal with that 20% uncertainty.
So did you have the test already?
No, the end of this month, when I go to
There's
work.
an iron particle that they put on a fluid in there that has an affinity for prostate cancer. That is particularly outside the prostate. So it'll pass through your lymph nodes and so forth, grab onto the prostate cancer cells that are there. And that's where they will tell you exactly which lymph nodes have prostate cancer cells in them. It's not that you have a tumor there or anything, but they'll at least know that there are prostate cancer cells in there.
It seems to me, why would you not want to know that before you finalize your treatment decision?
When Jeff told me this, I couldn't agree more, doing it, even though it was a costly venture compared to the rest of the issues that cost,
Yeah. You got $1,400 my life?
Yeah,
right, no brainer.
By the way, the name of the place is Landmark, Sand Lake.
Sand Lake in
Oh,
it.
Sand Lake, yeah. So I take it you've been there. Yes.
How does that change your decision making if you have metastasis? In
I
fact,
don't know that. I really don't know that.
you have
But at
a,
least I'm going in and my doctors will know that regardless of which treatment I suggest. But right now, Prothon is still my number one choice. My number two choice is to stay here and do, seeds with Daytoli. Daytoli, they wanna zap me for 37 days, then take about 10 days, 2 weeks off. Then you go to the hospital, then put the seeds in you. And, then you come back in like 3 months for another 10 days to clean up radiation. I like the fact that they're the ones that wanted me to do this study, this additional imaging, okay? I really like, I
So
said,
then
"Man,
you're basic urologist then also? Or they your
Urologist,
oncologist? Do you have a urologist?
I don't have much confidence in my
There you go.
urologist, okay? I texted my urologist afterwards, after he told me, I said, you never told me what stage I am. This is after we get the results confirmed from John Hopkins. He said, you never told me what stage I am. He texted me back, he said, oh, you're stage 1. Well, there is no stage 1 in prostate cancer. You know, I mean.
Did we ask you the name of that urologist or? Is it local?
Tingle. But they want to do surgery instead. So I think only when you get onto the oncologists and everything, where they're the ones that can start talking about proper staging. And
Well, I've had experience with a couple of urologists and they were not that way. They were pretty straight, gave me options, so, you know.
They're the person that's
You might
gonna
wanna
guide
change your-
the rest of your treatment, so it's kind of like when you go to a cardiologist, he's gonna refer you back to your GP for blood tests. So I would suggest shopping for another urologist
That's what I
too.
thought.
There's no point in not pissing this guy off.
Well, yeah, I'm not there yet, okay? Because of other things going on in my life and stuff like that, and uncertainty as to, you know, what it's gonna be like after treatment and everything. There's a good possibility, a very high probability that I'll be moving to St. Petersburg. So I'll probably just wait until I move there and then.
Have you considered checking with a general cancer doctor?
An
oncologist.
An oncologist, yes.
Yeah, I've met with, well, I've yet to find I think what you're referring to is a medical oncologist. I've yet to find one of those. Now, you can find a lot of radiation oncologists, and they all do their specialty of radiation.
Yeah, but there are many medical oncologists. I would follow that recommendation. That's what I did. In fact, I actually essentially dropped my urologist and used my oncologist as the base doctor.
Yeah.
In which then aimed me in the direction, if you're talking about the urologist, the oncologist put me in the direction of radiation and these other options.
You need somebody that doesn't have something to sell.
It doesn't have a dog in the hunt, right? No, I'm all for, please give me the names of medical oncologists.
Yeah.
If you're interested, I can tell you my story. I started a year ago. In fact, I kept track of my PSAs 10 years. I started at 2.1, I ended up at 6.1, and I followed with MRIs those years, and it was in one lower area, but it had a little bit of escape. So I'm 88 years old. I had to make a decision. Am I going to live with the cancer for the rest of my life, or am I going to take the treatment? So is it worth it? So, yeah, I did a lot of research, just like you. I went through the Proton thing. I ended up with the Tolley's. Started that in last July. I went through the Orlando labs.
What was your Gleason?
My Gleason was 8. I sent away the results of my biopsies to make sure, and went to 3 places, and I got good results. Ended up though that they found my PSA was 11.0 instead of what I had been getting results for years. Don't know why, but I didn't question it because I knew I had the cancer. I knew I had to do something, so I made the big decision, go. And I finally went with the Tolley's. I started, like I said, a year ago. Yeah, I went through a lot of medications through all this process. The hormones have driven me crazy. I did the 40 treatments. And last December, I went for my seeds, and they were implanted. I had a little side effect with my a little bit with the urinary system and a little bit with the bowels.
How long? You mean after the seeds?
Yes,
For how long after the seeds?
the urinary thing cleared up within about a month. The bowel thing, now I have it occasionally for maybe 3 days. At the end of the first month, after the seeds, I ended up with a 0.08 PSA. At the end of the second month, I had 0.05, and I had one 2 weeks ago, and undetectable.
Is that 3 months?
Yes. They take you through 3 months. They say you should recover pretty well. And I can't complain a lot other than the dang hormones they keep. You know, my question here, and the reason I came today is, what the heck happens to you when you go off of those hormones? And they're taking me off, they say November 1st. And they tell me I may have stuff with it for about a year, even after they take you off. But what's happened is my whole body went 180 degrees. I guess regardless of whether you go in proton or water, you're going to get hormones sooner or later. So anyway, yeah, my body changed. I was still very active. During a lot of this, I kept doing fitness center, my regular schedule. I had to stop riding my bike because of the prostate thing. But I got back at the end of the second month, I got back on my bike. I do that 3 days a week out on the street. And I'm trying to stay with it, but I've lost muscle volume with it. They tell me I should restore a lot of that, but I don't feel, being 88, I thought I was about 60 until I got into this, and today I'm feeling a little bit like 88.
You still look like you're 60 to me.
But anyway, like I said, I'm still exercising, doing my thing, keeping on good.
What other symptoms besides loss of muscle mass? What
It's
was
very
going-
sensitive, very sensitive. You're watching TV and there's a sad issue there and people are crying and next thing I know, I'm crying. If my family has an issue or something and it's very sad to me, I'm crying.
How about the high
From
full
what
flashes?
that?
And I can tell you, and I shouldn't tell you this, I guess, but 2 weeks ago, my wife died, and I just exploded. And I'm getting better from that. Showing pretty well. But again, I gotta tell you that I'm doing well.
Yes.
It's always
You look
very,
phenomenal.
very
I'm shocked you're 88.
Well, after I got done with the seeds, I had to go back in, doing 10 more treatments.
Yeah.
Those were for getting those things outside. In Orlando, they said I had some that escaped. And they got into the, oh gosh, what do you call
Seminal vesicle.
them? No,
Lymph nodes.
lymph nodes. And so, anyway, right now, they seem to be satisfied that they got it.
Yeah.
Because my PSA is showing really good. And so, November 1st, I come off of the hormones supposedly. And anyway, so what happens to the guys when you come off the hormones?
Well, I did the hormone thing and I did it for about a year. I did
Did
it
you?
prior to my radiation for 30 or 50 days, whatever it was, 40 days. Then I did it afterwards. So it was a total of about a year, 4 different 3-month injections. Not Lupron, but it was the other one called something.
Casadec.
No.
Evidard.
Eladon.
Evidard.
Eligard.
Eligard.
Yeah, it's the same as Lupron, but another
Yeah,
name.
yeah.
Well,
But,
our
Just
patch,
as lethal.
the patch comes off August 1st. Don't have to use those anymore.
I didn't find I didn't have problems with the hormones at all, other than the heat flashes. I didn't have the mood swings they kept telling me I was gonna have, or if I did, I just kind of,
But it kills you in the beetle.
Well,
Kills
maybe
what?
some,
You know, the beetle kills your testosterone, so I mean,
right,
bottom line, your life's not gonna be the same. That's my theory.
yeah, well, your
I've been
sex
through it
drive
all.
just disappears, yeah.
So they sucks.
But it comes back.
The thing that I fear, and you're the best one to address this, is, and I'm sure you want to know this as well, is everything you read about EDT, androgen deprivation therapy, says it's reversible. How long? Well,
I think it takes time. I mean, in my case, I think it's taken probably a year,
So 18
To
months.
reverse it?
and I'm not back to where I was
To
before.
reverse it?
To reverse it, I would say.
I just have it for 2 months, I got 2 more months.
Uh-huh.
And testosterone is 0.
Yeah.
PSA, everything is 0. I'm at the total cancer center.
Yeah,
I had radiation for 8 weeks, then I had a seed implantation in May 8th, so I'm going back to boost radiation for 2 weeks in August. And everything is 0 testosterone. And I have the ADT. And what you mentioned there about the laboratories, it's a Boston laboratory in Orlando. And they're supposed to be more accurate in detail. And if they decide your Gleason score is 8 or 11, that's what it says.
I can tell you the treatment's just nothing. You go in there and 15 minutes later, you're done
right.
and you're laying on a table, you don't feel anything.
Side effects.
Yeah,
You got side effects, so.
I wanted to say, you're my role model. Seriously, you're the age you are, and the cognitive abilities that you have,
Yeah.
and the active life that you have. I mean, recently active. I want to be you at 88.
Yeah, right.
Okay.
I want to be you at
Did you get
75.
any, did you get any hot flashes?
No, I never got any hot flashes, but I made some of the mood change might have been contributed to my emotions that I got, from time to time. It's,
How long is you have to be hormone, and how many more months you got to take?
I gotta take it to November 1st.
So already, how many months?
A year?
I've been on it, it'll be a total of from July to November, over 1 year. So it'll be probably 17 months, maybe 18 months.
The longer you take the hormone, the less chance of the testosterone to come back to normal. So sometimes if you take, more than a couple of years, and depending upon your age, it may never come back to normal.
Yeah.
what's,
Obviously-
the doctor at UFL, Dr. Bill, his last name is Mendenhall. His wife, also Mendenhall, she's the medical director. He makes it clear to everyone that he works for her, she's his boss. So that's why they go by their first names, right? So Dr. Bill, sent me a paper, and I can send an email it to you, research paper, a couple of them. And the good news is, he's talking about 6 months EDT, where they totally talking about a year. So I mean, in my mind, that's,
Yeah,
okay, that's another bonus. for them.
because you have Gleason score 8. It's automatically at 6 months. I had 7, that's 3 months, 4 months.
I was an 8, now they did a year.
A year, but
We'll
depends
see.
on the size of it, is it both side, how many?
Yeah.
Left side, right
Yeah,
side.
But they totally wants to do a year on me, at an 8,
Yeah,
just like, with the seeds.
I
But
wonder
for
if
proton,
Yeah.
Proton, they want to do 6 months. And I think I've got to even talk down to, let's do a 3-month shot and then reevaluate.
yeah, that's great.
Which is an option that you
So you could
do with almost
I
everybody.
understand they have Jan at, Maronite, does everyone know who Jan is?
Matter,
She
yeah.
even told me, she said now they have a 1 month shot.
Yes.
And the 1 month shot avoids the big flare up that you get. And, so she advised me to check.
1 month shot means it will last 1 month. Every month you gotta take a shot.
Right, I do that.
Yeah.
Yeah,
You do it monthly?
so,
Yeah, monthly.
by that
Do next
way,
week.
you can judge the side effects. So if you don't want to take it because of too much side effects, you can, after 1 month, its effect is out.
Yeah.
On the other hand, the 3 month shot, it will last 3 months. Once you are injected, you cannot take it back.
Well, and the thing I like about the 1 month is, let's say you have some weird reaction to it. At least you know, it's only gonna last a month, and then it's like, you know, if you need more ADP,
Yeah.
let's try something else.
My brother just did that.
So
He did a
he's-
1 month test, and he is gonna do another one, but he survived the first month
Yeah.
without any trouble.
Yeah, it's about.
What does ADT stand for?
Androgen deprivation therapy.
Which is,
Reduction of testosterone. Through chemical means.
Chemical castration is the scary.
That's the
term.
term,
Yeah.
yeah. Regardless, what I.
That's a really scary term. The first time you read that,
When you hear hormone treatment, you will think that it's like thyroid or cortisone treatment and so on. But it's not the case. It's what is castration.
Yeah.
Well, the whole concept is, I mean, what is a man without testosterone? You know?
Testosterone feeds prostate cancer.
Exactly.
That's why they're taking it away.
So they gotta take it away. I mean, so.
Quality of life.
but it comes
The
back.
quality of life is
It
not
comes
there.
back.
That's
Radical.
I mean, this is the only guy I know that's been through a year of it. And but you're still taking it.
I'm still taking.
But he's been through a year of it and has actually told me, I don't want to steal your thunder here.
No.
I might share with these guys what you shared with me regarding you and your wife, and things are good, you know?
I've been through a year, and
Not how
I'm
long
18
to-
months old,
Not
and I
100% great.
and I think it sucks.
How long took you to recover
think it's
the
like-
time
Oh, yeah,
I think it was almost a year.
after it stopped?
Yeah.
So you went through it a year, but you've been off of it a year? Almost.
Does it came back gradually or all of a
How
sudden?
long? Are you still on it?
I had my prostate removed, and I had reoccurrence, and I went on the Lupron and 40 treatments of radiation. I got off Lupron 16 months ago. My testosterone finally hit over 500, starting to get a little libido back, but it took up to this time, 17 months to even get libido back. And there's some psychological stuff going on there, because to even get some wood, I gotta use a shot. Because I don't get any erections. So there's all that going on before anything even happens. Plus I leak out a lot during sex. It's all so my sex life is not gonna be the same. And I was diagnosed at 49, and I sat on it for 4 years. Now I just got my test back, and my testosterone's back, my cancer's back. So I gotta go see my oncologist again, because I'm probably gonna have to go back on to therapy. So, you know, depression, my life's not the same. I smell piss all the time when I work out and I do anything hard, I smell piss. I gotta wear pads. You know, my wife thinks it's hard, so there's always a problem, you know, with the lack of libido. So, yeah,
You didn't have any of this.
yeah, I'm pesticides.
No,
Like a what?
You got a spray. You need those.
If my prostate's gone and I got PSA, it means I got cancer. If they thought it might be in the bed, they burned me dead, and I still have it, so it's probably, you know, prostate cancer hides pretty well in your body, it's hard to
Did
find.
you try Cialis to control your bladder beat?
I took Viagra,
No.
Cialis every day.
Cialis every day, 5 milligrams, that's what recommended to me, it works. Nothing to do with sex life, it's to control your pee flow, it helps a lot.
He doesn't have a prostate anymore.
I don't know, prostate.
But you pee.
No, I have incontinence, basically some incontinence where I leak out.
I understand,
Right.
that's what
So
I'm
you said
saying.
Cialis helps with the
That's
leakage?
what your doctor recommended to me. They have no scientific evidence,
Okay,
but it works.
Off-label.
Okay.
So I've been taking 5
for the
milligrams
leakage.
5 milligrams,
off-label use.
I've heard of that.
Interesting. I haven't-
Yeah, it's working,
and it
pretty much
helps
for me.
reduce the frequency of pee.
Right.
Did you go through Myrbetriq at all?
What?
Myrbetriq?
That's another one.
Yeah, it is. MYRB.
No, my incontinence is just, trying to have sex and stuff like that. That's
Yeah.
when
Oh,
it
okay.
leaks out,
Okay.
when you're being aroused and stuff
Yeah,
like
yeah.
that. And if I'm doing some curls or if I'm pulling the rod and
Right,
shit,
right.
I leak out.
I get
Or
that
bend
too.
over to do my shoes, I leak out.
I get that.
So by the end of the day, I smell piss every day.
Oh, yeah.
Did you ever tried any of the pelvic floor exercises?
I do Kegels.
All that?
Cute.
This is not cookie cutter. Your age, you're 66, not 80, not 8. I was 52 when I had mine removed, so it affects everybody differently.
Yeah.
But my thing is, my life's not the same, and I get the, it's good to be alive. But, the flip side is.
Have you
strap
thought
on, it's not
about,
gonna be the same.
Don't get discouraged because at your age, as time goes on, you may well do better. I have a friend who, it had metastasized, it was in his liver, it was in his lungs, and he had surgery after surgery after surgery after surgery. And then he woke up and he woke his wife up. So it can happen. And the other thing that I would recommend, I don't know if anybody else here has done it, is if you're interested in having penetration, normal sex, get an implant. I would have been, now that I've had mine for 7 years, I've had girlfriends that didn't know. And it's, and when told, they go, I never would have known. It works.
Did you have nerve
So,
sparing?
now-
Did you have nerve sparing surgery? So I'm not getting blood down there, so I have to do shots no matter what, otherwise it's a muscle
Yeah,
that's gonna disappear.
You gotta be a little careful. Yeah, well, that's the other thing. When you got the implant, it'll keep you from shrinking. And you can shrink down to the point where you won't exist anymore because you don't have the normal exercise. Once the implant is in, it stops the shrinkage. And I'm telling you, there were times, now that I got it, I think, wouldn't it have been nice at 12 not to have involuntary erections when the teacher called on you to
Yeah.
stand up? It's just totally reliable. I do not have disappointed lady friends. You wake me up when it's over. It's up.
So you
It
don't have to
stays
do
up.
shots because with the implant
No,
in
no,
there,
no,
it
no,
keeps
you
that
pump it.
muscle.
Yes,
Stretch.
yes. And the problem with the shots is I did have to have surgery after the shots because I got scarring
Scar tissue.
from a reaction to the Trimix. Yeah. So, I went through all of those things. And you'll hear people talking about, you want to have sex, you don't want to have sex, it's not important. And, there's other kinds of intimacy. We got an intimacy coach here. It's what you don't have that you want. And so I wanted penetration, and it was miserable 6 weeks, but it's been a nice 7 years.
Recovery for 6 weeks.
Yeah,
Oh.
and at my age or your age, to not be able to have incontinence is normal. To have ED is normal. To have shrinkage is normal, but you just make it go away with the implant. There's two different kinds. There's another guy here, who's not here today,
right,
that had it done.
yeah, John, yeah.
It works. And it's more reliable than, the question is, are you in the mood? The better question is she in the mood? If she's in the mood, you can fake it.
Yeah.
How about that? We're faking it for a change.
While you're talking about this, one quick point is that Dr. Green spoke to us a few months back about, I think he talked about both implants for what you're talking about and implants for urinary questions. He might be a great guy to see. He's going to come back and speak to us in a couple of months, but he's a local doctor right here and highly regarded by most people, and he would address these issues.
That's putting in the sphincter.
Yeah, yeah.
They are. Sphincter.
Oh, yeah. It's another,
With the surgeon.
just haven't both done it at the same time and go on with your life.
Yeah.
But once you've done it, you won't go back to normal, but it's better than normal. So I'm good.
somebody back there, you have a question?
How much, Does anybody know about the urethral sling? Because I have the same drippage, especially when I lift weights or walk or play golf. There's a sling that goes through. Does anybody have any experience with that?
It's the same thing they've done for women for years. And what they do is, as I understand it, they just raise it up so you have less gravity. And then they stitch the urethra higher onto the bladder. But the artificial sphincter is a better answer, and quite
I
frankly,
heard that's the gold standard.
yeah, quite frankly, I don't understand why they don't actually put a spacer in instead of stitching the urethra back up, because they're taking this much out. And every time you pull down on it, it tries to open
Who
the,
does the sphincters in Sarasota?
I think Dr. Green might be one guy.
I'm just
the other
asking.
fellow, I don't know.
When you have it down here or someplace else?
Yeah, long time ago, you didn't
Dr. Kelly might be, Dr. Robert Kelly.
and the implant.
This, I think, but I'm not.
You mentioned something about.
Gary and Green are together, all close to the,
Which one?
What did you mention about?
Myrbetriq?
Yeah.
Yeah, that's what helped me
What is Myrbetriq?
minimize my, that's on TV all the time. Okay, you want.
So one was seldom fatal side effects.
What?
Seldom fatal side effects. You'll instead of finding
What helped me though is you know, I'm always at doubting Thomas like we all are. I can't speak for all of them. I am. And I took it at 25 milligrams and I said, no, nothing's working. So he increased it to 50 milligrams.
Oh, yes.
And that made the difference. I took that every day. But I found after 1 month, I didn't need it. And I wasn't having, I mean, with the exception of jumping or quick movements. I'm a tennis player, and if I run up and bend down, it's gonna happen. But I deal with that, but my point is I reduce the frequency of that. Yeah.
Whoopi Goldberg had a joke one time. She says, I used to, and this is more normal for women than it is for men, but it happens for everybody when you get older. So she said, I used to carry an extra pair of panties in my purse in case I got lucky. She says, now I carry an extra pair in case I sneeze. But all this is normal. We have a better excuse than most people. So, and I'm not going about what happened.
Let me ask a question. Has anybody had a Gleason of 6 and no more? Anybody in this group?
I had a 3-4.
3-4, but the 6 you might have had?
I
Six and six.
had a 6 initially,
3 and 3.
3 and 3.
And yourself too?
Yeah, between 3 or 3 and 4, they biopsied me and I got a serious infection, almost died.
Biopsy was worse than the surgery for me. Ed and I have both had the radical surgery, which I probably would not recommend to you if you've already got metastasis. But if you don't, if you caught it early and you have a fairly low score, I mean, to me, I woke up and they said, "Oh, let's watch and wait." And I said, "What am I watching and waiting for?"
Yeah.
And the answer, some of you know. But I got up every morning and I said, I got cancer. And I said, I want to wake up some morning and say, "Don't." And for 14 years now, I can wake up and say, I don't have cancer.
It depends on your age.
I was 63.
Yeah, that's young. That's
That's
understandable.
surgery
normal.
But
automatically.
if you're over 70,
Yeah.
you want to think something different than surgery.
Well, it depends on how long you're going to live. There was a guy here that was 85, and he said, they told me, don't worry about it. You're 85. He says, my parents lived to be over 100. He says, I got that many years left to go. I don't know if you remember him.
Yeah.
But he was going to be very aggressive. You kind of have to lead your doctors. I think we've all learned that. Make your own decision.
I think Tingle mentioned that to you, surgery, right? Because of you're not over 70. that's
Well,
all.
at my age here, I'm being 66, he said, my options are surgery or radiation.
Okay.
That's all he said.
But if you have metastasis, you might as well go with radiation.
If
I
you
don't
were
know, I
70
don't know for sure. All I know right now is I have suspected vascular extent.
Yeah, I had the same thing with region 7, the third on the left side. That's why I'm getting all.
But if you have,
So there-
if you have good margins and it hasn't escaped, there's a 93% survival rate for 10 years.
You had bone scan?
And negative.
Bone scan was negative, and I asked my primary, I said, so, you know,
That's good.
when you read this, what the hell's all this foci uptake? I said, is this saying I have arthritis? And pretty much throughout my body, I guess I've got arthritis. I said, I didn't know that. And, but the bone scan was negative for
Yeah, that's the
the cancer.
experience.
So I asked, I said, what's the accuracy of this bone scan?
You know, if it's an experienced radiologist, they can pretty well accurately tell whether there is meds or not. And there are other blood tests which also shows. What was your PSA?
6.2.
It was not very high.
No,
It's, if there is metastasis, usually the PSA will be much higher.
You see, I could never get an
And
answer.
there are some of the other blood tests like blood chemistry, which can show if there is bone metastasis. It will show.
Well, isn't that really what this imaging is in Orlando is?
It's a new,
No, right here.
new imaging area, which is specific for metastatic disease. New imaging area. It's, we don't have that much experience, but you know, in doctor's hospital, facility with imaging area. I forgot the name of it.
FEMUR or something like that, FEMUR.
Yeah.
Femur process. FE is the symbol for heart. That's where they get that process.
Ferrum, is it?
It has something.
Pherome, something like that. Pherome.
No, you're thinking pheromones.
It has something to do with
Comes from that
the
FE be dealing with iron.
Yeah.
Really curious if anybody ever told the bone scan guy that he should be looking for cancer. And they don't. I even tried to get my GP to tell him, here's my concern about my red cell count. You know, because red cells come from bone marrow. And by the time, you know, it's just,
I found that most of the doctors direct them from a particular point of view.
Really?
My guys did,
Yeah.
yeah. And it was clear
My guys did
in the
that.
order that they were looking for cancers.
yeah. I mean, that would be a question with the bone scan. Oh, by the way.
Yeah, I could never, I asked my primary, I said, you know, how accurate is a bone scan? And she felt pretty comfortable that, oh yeah, you know, it's accurate.
I was in the hospital with my mother and they said she had a heart attack. I said, no, she had a stroke. No, she had a heart attack. I'll go back and look at it again. Came back, no, she had a heart attack. I said, I've been looking at this face for 60 years.
Oh my God.
I said, she had a stroke. Those are opposite things you should do. And they went back and looked and says, you're right, we saw it. She had a stroke, but great, then get her off of the treatment for lowering her blood pressure and go after the stroke.
You know, I want to address something that just was.
That's generic.
The undercurrent of this conversation just now. Our role as patients, it's going to be a little radical and about this. Our role as patients is to direct our doctor. We may think there's a model out there that we go to the doctor to find out what will help us and cure us. But that's only true if you interact with your doctor and direct him as to what your most immediate concerns are and what you may have heard elsewhere. Now, you bring it up, sometimes the doctor will say, well, don't believe that garbage. Or they'll imply it. If they do that, that's one indication that you need another doctor. Because you need a doctor who has an open mind and has a experience with urologists or is a urologist. And also has a good interaction with oncologists. Now, one of the better practices for oncology is just down the street on Gulf Avenue. Does anybody meet an oncologist? One of them spoke here a year ago or so is Dr. Brown. He's head of the practice, but they have a couple of newer, very alert oncologists. And if anybody has what we typically call advancing or advanced prostate cancer, you want to be in touch with an oncologist,
A medical.
a medical
Not a
oncologist.
radiation.
They deal with cancers of all kinds, not just prostate cancer. And they don't have any, like we said earlier,
Without a dog in the mouth.
they're not gonna tell you, they may recommend what urologists they might suggest for your particular needs, but they don't say radiation is best, surgery is best, whatever it is, okay? They may come up to some conclusion at a certain point based on your individual situation and conversations, but they're not prejudging what you need, okay? So an oncologist for advanced prostate cancer is advisable.
Not biased.
There's no bias there. They may favor one urologist over another based on their experience or interactions. That happens.
That's okay.
But that's okay, because you want somebody who has a relationship with your urologist, and therefore they're going to be a team. The worst part of doctoring today is you got 5 doctors, I know I do, and they don't talk to each other. There's no
And we're
teamwork.
not gonna get 10, 15 minutes of their time.
So our job is to make them a team. Our job is to ask, I know you're gonna say, who does that? I do. Okay? Some people I know do it.
I do.
Could
He
you call
does.
my oncologist, who's so-and-so, and have the conversation you just had with me with him? Or is it okay if my oncologist calls you?
And the other thing is, that I've learned, don't assume that your primary is aware of what's going on.
Exactly. Ideally, it's the primary who should be the team leader,
They're not.
but it hardly ever happens.
Especially, I found, once you go on Medicare, when I say I go to my primary, I've yet to meet the doctor. So is one of the nurses that you're dealing with, because Medicare only pays so much money. And if you want to meet the doctor, you have to specifically request an appointment.
And you
That's
do
not the
that.
case with me.
You gotta
I
act
had
in your
my
own best
primary-
interest. Don't settle for a
Every
PA
time I go.
or a nurse practitioner when you really need a doctor to answer your particular question. I once went into, I'm also diabetic, a few other things going on. I went into a fellow's office and she said, well, I can answer those questions. I said, I know you can, but I want the doctor. What, you don't trust me? She was offended. I said, actually, I trust the doctor more. I'd like to speak to him now. Other things about her, but the point is, I got to see the doctor.
Yeah.
You gotta do what's right for you. You're the patient, or put it differently, you are the customer.
Yeah.
You gotta take that model in mind and always be testing your doctor for his knowledge or lack thereof. I have yet to meet a doctor who knows it all. Hasn't happened to mine. And I'm 75, folks. I've been around for a little bit of a while. Interact with doctors all my life because of various maladies that preceded my prostate cancer.
Kind of have to be gentle with the Rigosa because Medicare, I had a hard time when I came down here finding a doctor who would take you into the practice in Medicare because of the billing.
Yeah.
Just one quick comment. I wasn't gonna bring this up, but you kind of opened up or maybe I did, the whole communication thing. They sent you 20 some odd, 12 or so ambassadors you could talk to. That was their success story. They are not going to send you to somebody that says, yeah, but.
I've thought about that too. And that's why I've reached out to people I know that had proton therapy not there. Actually, two gentlemen, one's an uncle and one's a friend that are in their 80s. They had it in Oklahoma like 10 years ago.
Yeah.
And they both said, yeah, just go do it. Don't even think twice. It's like,
10 years is the number we look for. And I came back to this group after going to a group in Virginia, and there were years where I didn't even bother to think about it, which was nice. PSA always came back, zip, zip, zip. And I did this money raising thing that I do, motorcycle ride for. Prostate cancer research, we raised $6 million internationally in one day. And I'm just a small part of it here. But there was a group in Virginia that gave some money, and I thought, well, I'll go to their meeting. They had a round table just like this, and I stood up and I said, well, I'm a 10-year survivor and blah, 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 and kind of smug and sat back down. And I heard some guy in the back say, yeah, that's when mine came back.
Oh, no.
Hello.
And you're going,
So, you
"Shit,
know,
why
you
am I
were
coming to
predisposed to it,
Thought you
number
were
one. And number two, you know, everybody gets it, I don't know, you just can't get smug about it, you gotta stay on it from now on.
Well, I spoke with
Watch,
a
watch,
gentleman
watch.
recently, and I'm sorry, I don't recall his name, I could find it on my phone. But actually, two guys, spoke with, there's another architect here in town, and so over 10 years ago, he was treated at Loma Linda, which was the original Proton Center. He had nothing but great things to say about it. And he said, oh, you need to call this other guy. This other guy lives in Sarasota, and he's on the board of directors out there. And he's very active in raising funds and everything and stuff. And I actually invited him to come here today. I guess he's not here.
Carl Abbott.
Well, that's the architect.
That's the
That's not that wasn't the guy.
You know, I'd like to just one other issue, because it keeps coming up. We've already touched on the incontinence. And clearly what was stated by several of us is there are different approaches toward holding back the dam. Whether it's surgical or chemical. And ultimately, the software in the terms of the pants, that's really software, right? It's getting better and better in terms of 3 layers. And, you know, you don't have to depend on Depends, by the way, they're not necessarily the best. But they have 3-layer stuff which contains it. They now have a catheter, portable catheter. It's yay big, you put it up on, not in, but in front of the penis, and you have a way to collect it. Every 3 hours, you go to the bathroom, empty it, reusable.
Condom catheter.
There's a lot of good stuff that's come out just in the last couple of years. But above all, you gotta have a urologist you can rely on, who is the one to tell you which is most suitable for you. Most urologists, you know, are also kidney experts. And they're all trained surgeons before they became urologists. So bear all this in mind, so that you have greater confidence that if you encounter that urological issue, you can find a solution. But the equally onerous one that's come up at least 3 times today is the whole issue of intimacy. And yes, now for me it's 12 years since my radical prostatectomy surgery. Intimacy for me was the #1 enemy. I just couldn't contend. And to be honest, I still have some issues. But what I've learned is, and it's not original with me, is that since you know life is going to bring changes, regardless of whether you have prostate cancer or not, as you get older, almost universally, life by definition changes as we get older, right? Sometimes for better, by the way, but usually not. Okay? Maybe there's a different approach. And the one I'm looking at now is called a soft entry. So that if you have a spouse, a wife, a partner who's willing and has that kind of relationship with you, hopefully that person's understanding that you can't get it up the way you used to, but maybe she's had some deficits too as she got older. So that's a field of communication you can think of as a 2-way street, and just poor me, poor me, poor me. It's a way of saying we both have to accommodate to each other as life goes on. Postmenopausal, all the rest stuff we all know about. The soft entry approach allows for a sense that no matter what we feel at the moment, and even if we can't get it up whatsoever, she has fingers, you have fingers, you can still place it in the front part of the vaginal area, because that's where the woman's nerve endings are most sensitive, where she will get the most pleasure anyhow. I don't have to tell you all the birds and bees stuff because you already know that stuff. But think about that as one way of adapting, given the health circumstances you and she may be currently facing. The point is, don't give up on sexual connection, let alone all kinds of other forms of affection that are not what they call P and V, penis and vagina. There's so many ways to relate affectionately and cordially, and with mutual support, that we need to broaden our horizons. God knows, if I only knew 30, 40 years ago, I've been married 47 years. If I only knew 30, 40 years ago, I can tell you our relationship would have been a lot more satisfying, at least if you were to ask my wife. Really true, isn't it? So we can use the wisdom of aging, that we all are increasingly subjected to start looking at alternative approaches that may not be the same, for sure, as when we were all young bucks, but certainly will give pleasure, mutual pleasure, in increments as you learn to use those new tools. There's something to think about. Don't give up on yourself is the only point in it.
The only problem I've got with the implant is most of the women my age can't tolerate, because of vaginal thinning, they'll get scarring and bleeding and tears. So, you're back to square one,
And they may be happier with a soft approach, a soft penis approach, because for them, it's more, they can tolerate it better physically, just purely physical. It's nothing personal, guys. It's not personal. That's the hard part that I had to learn and to teach my wife. I used to tell her, it's not you, honey. I don't look at any women. By the way, I started looking again. I'm cured of that problem. But
that takes
to make them understand,
about a
make
year.
your wife understand, or spouse, that things have changed. Let's be open in our communication about what we can do to offset this stuff.
I've got an
We have
idea.
on our own interpersonal relationships.
Why don't we have a lesbian come speak? Well, is that not funny, or are you guys saying, yes? Maybe it's a good idea.
We only have a couple of minutes.
Someone mentioned Seattle.
I'll watch.
Milligrams once a day for urinary incontinence. I mean, that's off-label, correct? Because it's
Yeah.
not for.
It's not, the FDA hasn't approved it for that,
Okay, but it, and.
but it works.
Where did you buy it, though? that
Oh,
you
I buy it
have-
online to a Canadian pharmacy.
My urologist prescribes it for me.
Yes,
Yeah, no, it
They can do
prescribes.
that.
I understand that, but where's the cheapest place?
That's what I'm, that's what I'm sharing.
Yes.
That's what I'm sharing with you.
Okay,
I buy it to a Canadian pharmacy
okay,
from Vancouver.
okay.
They're very reliable and they mail it to you. And if you want the phone number, I'll be happy to share it. If you give me your email, I'll send it.
Florida just
There's
passed
also-
a law
You
too,
have to have prescription.
Yes.
that they can buy, that there
Yeah.
are pharmacies, not the big name pharmacies, but street corner pharmacies are bringing stuff in from Canada.
Right.
And they've got, Niagara down to $2. A
It's
piece,
very
I think,
expensive
something like
compared
that.
to what I pay in Canada.
There's
So-
also a discount pharmacy on the corner of Tuttle and Bee Ridge called Sun Discount Pharmacy.
They couldn't beat the price.
No, Canada, I also get stuff from Canada too, but I'll go to one other thing that hopefully will give you hope. After about 6 years, almost 13, whatever that is, out, it's 11, 12 years out, I started testosterone replacement therapy, which is very expensive, except there, for a month, you can get the testosterone cream for $60 as opposed to $120, $200 elsewhere. Haven't explored Canada Pharmacy. Then I decided, because I was subpar, I could get it covered under Medicare. Instead of out of pocket, I'm on what's called Testapel, which is in the doctor's office. It's considered a treatment that's fully covered by Medicare, no $0 cost. One injection every 3 months.
Doesn't that fuel prostate cancer?
No, that's why I had to wait it out.
I see.
I did not have a recurrence,
Okay.
and that's why I asked earlier, who has like around a 6 Gleason? If you have advanced prostate cancer, this is not for you.
No, I understand.
But if in my case, I had prostate cancer, which, the part of the prostate was impinging on my bladder. I would have been a urological mess if I hadn't had that surgery. Okay. And then I waited out 2, 3, 4, 5 years till the doctor said, okay, you got a green light. It is true, as we just heard earlier, that 20 years later, someday, you might be able to, you might unfortunately have a doctor say, hey, guess what, it's back. But, you know, at a certain point where you've been clear for 5, 6 years, you can say to yourself, there are advantages of to testosterone above and beyond the immediate problems we're facing, including reducing feelings of well-being, allowing for stronger bones. That may make it worth exploring if you're in the enviable position to be a candidate. But don't give up on that possibility if you get that far, as so many of us will.
I'm gonna make a comment about you. I was diagnosed with prostate cancer in 2010. And doctor wanted to take it out, because that's what he did. And I said, can I see your oncologist? So, and it's your radiation oncologist, and talk to him about this kind of thing. And he said, yeah, so I made an appointment with him. And I told him but I said, before I come in, I said, am I gonna be able to look at these cell structures that they did when they pulled out those little tubes and so forth? And he said, I can get those and we'll go over them. I said, great. Well, I was rated a Gleason 7, 4 and a 3, 3 and a 4, whatever it was. And that's why the gold standard was for this one guy to take it out. So I went over this with him and actually looked at the cells. And by the time we were done looking at the cells, he said, you know, you're probably a 5 on the Gleason scale as opposed to a 7. And I guess I was interested in doing this because I was a chemistry and biology major. So I was used to looking at things under microscopes and so forth. And so by doing that, he says, you're really a wait and see guy. And so I had 8 good years of a wait and see guy from 2010 to 2018. And I probably could have gone longer, but I went to have a good family doctor, and the radiologist allowed me to talk to him about doing supplements and so forth. And there's a group on the west coast of Florida called Life Extension Institute. And they have doctors on staff over there that you can talk to. They'll recommend what you can do to prevent that from increasing and holding it steady and so forth. And I worked with them for 8 years. And middle of last year, I came up with polymyalgia rheumatica, which is an autoimmune disease. And I'm trying to diagnose it properly. It takes about 3 months really to do that. And my wife was with me in the doctor's office, my family doctor's office, and she says, he confirmed it was autoimmune disease. So he sent me to a rheumatologist. And my wife was sitting there, and she says, well, if his immune system isn't working, what's this doing to his prostate cancer? Because I mean, I had CT scans periodically. There's a very distinct nodule right in my prostate, and nothing else has ever shown up anywhere else. And I reviewed this all the time with the doctors and guys who do the CT scan. I get the report and I go in and say, okay, now you put this MRI on top of that, let's look at it together and so forth. I mean, I really pushed this thing to make sure I knew it wasn't spreading for 8 years. And all of a sudden, took my PSA was going up like 1 point a year. So it went from a 5 to 11. And all of a sudden, my wife said that. She said, well, let's do a PSA again. Guess what it was? 23. A month later, and then, so I immediately, now I went in the meantime, during that 10 years, I didn't sit on my hands either. I mean, I was over to Jacksonville about 3 times. I was up to Daytona about 3 times. And I went somewhere else in the beginning too, but I knew I was going to go. If I had a problem, I was going to Daytona or to Jacksonville. Interesting. And in some of my trips to Jacksonville, they had these conferences, and people came back that had treated there already, and they gave some talks and so forth. And I was there a couple of times when there were a couple of guys came back for a re-examination and so forth. And I talked to 2 of them really pretty thoroughly. And they talk about this treatment was designed, this proton treatment was designed for brain cancer. And the idea was, you got all that very sensitive tissue around this tumor, and you don't want anything else to get damaged by it. And so the proton is very, very specific, where it's going to do its curing and curing the cancer cells. And so you think, well, yeah, then why shouldn't I do this for my prostate, even though it costs more, everybody naturally, to do all this stuff. But there were guys over there, whoever does it for you, how much movement you get, whether you treat that balloon's in there right, and so forth for them over there. There were guys that had some liver damage, and other guys that had bladder damage. So not everybody, even though it's proton therapy, very specific where that heat is, it gets outside there, and there's people that still have some problems. So that you gotta know going into this thing.
Yeah.
And very frankly, I knew this, and all of a sudden I come up here today, totally, and they says, they did a check for me. It wasn't 23 a month later, it was 30 a month later. And by the time I started, it was 36.
Wow.
So
When did you do
mine
this?
was escalating very, very
This was
fast.
just in the past year or so.
Yeah, so I actually got confirmed in July last year that I had PMR. And polymyalgia rheumatica, autoimmune disease. So, and it was, I guess, in early August that where I'm sitting with my doctor, and my wife says, "Hey, what's his prostate doing?" And so he texted 2 days later, I had the results. It was like 11 done, now it's up to 23. And then it went up to 30 and 30. A month later, it was 30. A month later, it was 36. By the time I started my treatments, it told me.
Did you have previous treatment at Jacksonville?
I had no treatments at all for those 8 years.
You said you went there several times.
Well, they had conferences they'd call you up to.
But not for treatment.
Yeah, not for treatment, just to know what's going on and so forth. And I had a person to contact up there in case I had problems. And it was, to me, it was, they totally does nothing but prostate cancer. They seemed to know what they were doing. When I went in there to get an evaluation, they says, "We want you to head over to this guy at Sand Lake Imaging now."
Well, the doctor in Jacksonville that I met with, Dr. Bill, I told him, other options. He said, you can stay in Sarasota and get treated.
Yep.
And I said, what about Daytona? He said, he's got an excellent reputation.
Yep.
So he wasn't dissing other people.
That's a good sign.
Does he does they totally do proton?
How young were you?
No, it's the seeds.
Decided to,
Well, radiation and seeds, yeah.
I was 70 years old.
you were 70 years
Yeah.
old.
Now I'll be 79 this year.
Yeah, I'm in the same boat as you.
One of the other factors about proton, which is interesting, is when you go up there for your first consult, you meet with other people before you even see the doctor. One of the first ladies you meet with is the lady that takes all your insurance information, Medicare. They want to make sure they're going to get paid. And they also, one of the things that you sign that you agree to is there's a limitation of liability of $300,000.
Okay.
What does that mean?
Well,
I mean, if something goes wrong,
you
you sue, you can only get $300,000. Well, more accurately, your attorney can only get $300,000.
Yeah. If there's any left, you get it.
Yeah, isn't that state law? Isn't that the maximum?
I don't know.
I think it is by state.
I don't know.
I wonder if I signed something like that. I can't remember.
I don't know, because they're a not-for-profit institution versus, I don't know.
How does
Versus
that affect your
versus a
decision?
private practice, I don't know.
Does that affect your decision to go with them?
No, well,
What does it tell
I'm
you?
not married, but one of my sisters went with me. She spent 35 years as paralegal. And that kind of, she
Yeah.
pointed that out to me, like, you remember that, right?
Oh, okay,
Yeah.
okay, interesting.
But will that weigh on my decision? I don't think
I
so.
don't think so.
I don't think so. I just mentioned it because,
Interesting.
yeah.
It is
okay.
interesting, yeah.
Factoid.
Yeah, in fact,
Go where you think you're gonna get best treatment for what you have.
Yeah.
That's what you gotta really think about. But not, I mean, I would never, I never go, even if the doctor makes a mistake on me, I'm not gonna sue I know he's trying to do his best. You know, no one is 100% successful. I think they do.
Well, guys,
I have a,
go ahead.
one other question. I've done an appointment Wednesday. Reading up on ADT, one of the potential side effects of ADT, other than the emotional and loss of muscle and hot flashes and all that stuff, is heart damage. So I have an appointment Wednesday with a cardiologist.
Mhm.
And I just want to ask him, if I'm looking at ADT here, you know, what, I want his input. I want him to be, first of all, establish a relationship with one that I've never been to a cardiologist before. And then second, I want his input in terms of, he may know, oh, this works better, stay away from that type of thing.
Who are you
Well,
going to?
The length is important. I have heart disease, and 6 months is fine. If you have a 2 years, it's another
But
story.
see, I thought I was fine until I found out I had prostate cancer. I think I'm fine, but I've never been to a cardiologist. So, Dr. Morsley,
So that's mine.
Morsley.
That's mine.
I
Then he
have
knows.
And the other one too.
I have a friend that she works at the hospital doing a cardiac cath lab. And I asked her, who do you recommend? She said, it'll take you she says, if you call, it'll take 6 months to get in to see him.
Fortunately.
She called, got me an appointment in 10 days.
More sleep?
Morsley.
How do you spell that?
MORSLI.
Intercoastal.
Yeah, so he has privileges in Sarasota Memorial Hospital.
Yeah, there's also Dr. Schreiber in the building behind SMH.
How do you spell that?
SCHRE.
IBM.
You have no high blood
There's
pressure
a
or.
large practice of doctors there.
Well, we're in the age group where you start
They
to have
said,
cardiac.
they said I was
So-
pre-hypertensive because I was like 140 over 90. But I started exercising and working out and everything. Now I go in there and they go like, wow, we're impressed. I'm like 120 over 80. So, you know.
I think it's a great idea though. to do it.
We're in the age group where we have heart disease, so that's one thing they'll check for, no matter what they give you.
Well, if the prostate doesn't get you, the heart will.
Yeah.
Okay, so I'm going.
That's why I'm looking for cardiologists right now myself.
So I'm going like,
It's the only muscle that never rests.
Well, guys, I think we've got to wrap it up, but it's been very informative. Hopefully for everybody.
Another one next month?
Another month, next month, we will meet, same time, same place. I think we're going to focus on exercise next month. We've got a guy coming in. Should be kind of fun.
You better not steal